Every day, millions of people around the world battle tuberculosis. TB doesn't just affect health, it affects families, livelihoods, and communities. In 2024 alone, an estimated 10.7 million people fell ill with TB, and 1.23 million died despite the disease being preventable and curable. Behind these numbers are real people facing long care journeys, misdiagnosis, and stigma. People forced into difficult choices about work, school, and family due to health, social, and economic consequences of TB. Each year, more than 2 million people with TB are missed by health systems, not because they don't need care, but because social and structural barriers stand in their way. TB is not driven by biology alone. It is driven by inequity, with men disproportionately affected. That's where LIGHT comes in to address these gaps. LIGHT is a 6-year global health research program funded by UKAID, led by the Liverpool School of Tropical Medicine, working with partners in Nigeria, Kenya, Uganda, Malawi, and the UK. LIGHT generated evidence to strengthen gender-responsive TB prevention and care, informing policy and practice in line with the World Health Organization's End TB strategy. People affected with TB were at the heart of the program. LIGHT used different research methods and participatory approaches, working with communities and healthcare workers to co-create solutions that work for them. In Nigeria, community-designed gender-responsive interventions reduce TB-related stigma and improve TB knowledge among men and affected communities. In Uganda, a male-friendly integrated TB screening package increased TB detection among men by 51% in participating facilities, while also indirectly benefiting women. In Kenya, research with young people identified gender-specific barriers which informed youth and gender-responsive TB services. And in Malawi, a community-based survey found out that from late adolescence onwards, boys and men had higher levels of TB exposure than girls and women. Insights into their experiences and perceptions of TB care highlighted opportunities for targeted strategies to reduce TB transmission. Using National TB Survey data from Kenya and Nigeria, LIGHT showed how poverty, education, and gender shape TB risk. It showed persistent inequalities and demonstrated how routinely collected data can inform fairer policies and planning. LIGHT strengthened sex-desegregated TB data collection and use. We modeled strategies to improve men's access to care, supporting smarter use of resources. Over 6 years, LIGHT built trusted partnership across national TB programs, governments, universities, communities, civil society, media, and health services, so evidence could inform real-world decisions. This included shaping national TB strategic plans, policies, and supportive systems in LIGHT countries, embedding gender, human rights, and community engagement. LIGHT also shared evidence at country, regional, and global platforms, helping position gender-responsive TB care as essential to ending TB. LIGHT showed that research is most powerful when it is locally led and owned. The program strengthened knowledge and skills across researchers, program managers, administrators, institutions, communities, and stakeholders, and invested in future leaders. The media were also supported to communicate evidence more effectively. These efforts were grounded in equitable partnership principles. Shared leadership, mutual respect, transparency, and meaningful collaborations ensured inclusive decision-making, fair recognition, and shared benefits across partners. LIGHT demonstrates how gender-responsive TB research can drive meaningful change and contribute to a more effective, equitable, and gender-responsive TB response so that no one is left behind. We thank UKAID and all our stakeholders for supporting research and partnerships across Kenya, Malawi, Nigeria, Uganda, and the UK for making this work possible.